Hi, everyone. Thank you for joining us for our webinar today. My name is Shay McNally. I'm the marketing specialist with R3 Continuum, and I'll be helping moderate today's webinar. Today's webinar is titled Imposter Syndrome, How to Understand, Acknowledge, and Overcome It. A couple of housekeeping items to address before we get started today. There are a handful of pop-ups and widgets on the screen in front of you. The most important is being the question and answer or the Q&A box on the screen. So please feel free to use this widget to ask questions or give us comments or feedback throughout the webinar. And if we have some time at the end, we will be able to answer and address some of those as well. If you're having any technical difficulties, you can also use the Q&A box and we'll be able to help you from there. You'll also see our resource list, which holds plenty of links for you to check out, including some of our upcoming webinars, the Workplace MVP podcast that we sponsor, today's slide deck that you can download, and more. Our presenter today is Dr. Tyler Arvig. Dr. Arvig is a clinical psychologist and associate medical director for R3 Continuum. He has over 15 years of domestic and international experience in behavioral health workplace absence. He's an engaging public speaker who regularly presents at national and international conferences and to large and small organizations on work absence topics and clinical issues in the workplace. He has experience training and mentoring physicians and behavioral health professionals. And Dr. Arvig also has several peer-reviewed journal articles and is frequently cited as a subject matter expert. He's also a high-performance driving instructor, racing enthusiast, and in his own words, a very slow auto mechanic. So thank you for being here with us today, Dr. Arvig. So today's topic will be covering imposter syndrome, and I think this is a really important or interesting topic to discuss, something that a lot of us may have felt before without even knowing it. So Dr. Arvig, can you start us off by giving us some background information on imposter syndrome?
Absolutely. Thank you, Shane, and thanks everyone for joining us to talk about this topic. And the first thing I want to say on imposter syndrome is it's not a real syndrome in the way that you might think of syndrome. We sometimes use syndrome or disease in clinical terms, and this is not a clinical condition per se, but it's a combination of factors that hang together that describe some of us in our lives and what we might be feeling or experiencing. So you might hear someone use the term imposter syndrome, and really what they're talking about is, let's look at what, for this person that might have these traits, what does it look like? Well, it could be an inability to realistically assess your competencies and your own skills, attributing your success to external factors. So, I succeeded here not because of something that I did, but because of other people or other factors. It wasn't my own competency. People that experience this might berate their own performance. They might do really well with something, but then beat themselves up over it after the fact. There's often a fear that you might not live up to your own expectations, because people with this cluster of issues tend to have very high expectations and maybe unrealistic expectations. People tend to be overachieving. You might occasionally also kind of sabotage your own success, or you do something and you could do it perfectly, but you do it less than you could, less than your own actual ability. And most people with imposter syndrome experience a lot of self-doubt. And again, this can be, we'll talk about in a few minutes, but in a variety of areas of life. And then setting challenging goals and feeling disappointed when you fall short of those goals. So this is a lot of different things. And my guess is everyone in the audience can identify with at least one of these, if not several of them, or maybe even all of them. And my guess is at different times, we've all felt all of these things, maybe not all at the same time. But this is really, imposter syndrome in a nutshell is not having confidence in your own abilities.
Yeah, absolutely. And I just want to kind of give a shout out to our graphic designer, because I think that the graphics, like this graphic right here and the one on the next slide, are really kind of help encapsulate that. You could be the most top achieving person ever, and you may not feel that way at all. You may not feel like you've earned that or kind of are justified in that. And that, I think, really kind of speaks volumes to that. I mean, so maybe you get an employee of the month and you're like, well, I did one thing this month or something like that. And, it can kind of wear down at you, just like kind of these graphics we're talking about.
Right.
So can you kind of talk about, you mentioned we've probably all felt something like this, but kind of like where and who does this happen to?
Sure. Well, I mean, honestly, it probably happens to a lot of us. But where we sometimes see this is in if you search for it, you'll find in some of this information, I searched for and found, you'll get a lot of people, particularly, maybe some celebrities or people that run companies, chief executives, sports stars, will often have this sense that, they're really not as good as people think they are. And it's funny, just yesterday or last week, I was reading an autobiography of Johnny Ramone, who was in the band the Ramones, guitar player in the Ramones. And they weren't very good when they started, but people liked them. And he had this thing of, they'd play a show and people would come up and say, you guys were great. He's like, yeah, we fooled them. And that was their mindset of, we trick people into thinking we're better than we are, until at some point they started thinking, hey, maybe we actually have something. Maybe we actually are better than we thought. So it's the sense of, I fooled people. And again, search for it and you'll find lots of sports stars that we, Suni Lee and, lots of every A-list sports star if you can find is probably experiences some of this to some extent. I love this quote. Tom Hanks is one that I like this quote so much I have put it in here. And you think, how could Tom Hanks ever get fired from a movie? But it's every movie the first week, I always feel they could fire me. And you're thinking, who objectively would fire Tom Hanks? Nobody would. He's probably the best in the business when it comes to this stuff. But even at that level, there's that sense of, maybe I'm not as good. Maybe I'm fooling people into thinking I'm better than I actually am. And this isn't only related to professional stuff. This isn't only related to my competency in the work environment or in my chosen profession or my chosen sport. This can also occur in social circles. I'm not good enough. I'm really fooling my group of friends. I'm really not as good as they are. Or even in intimate relationships, where you think, this my partner is, they're really much better than I am, and I'm kind of fooling them right now. But eventually, they're going to see through it and figure out who I really am. So this is, and I mentioned that, and we talked, the celebrities and the CEOs and the sports people, all fine and good. None of us here are that, probably. But you don't need to be, it's not only people at the highest level that experience this. It's all of us to some extent. And, recognizing it, and we'll talk more about that. What do you do if you start recognizing it? Or what do you do if you start having some of these doubts? Because it is something that can eventually erode your confidence and actually erode your performance if you can't be aware and of what you might be experiencing. And to some extent, part of it is just stepping back, recognizing, when you're having those types of thoughts and being able to step back and go, okay, objectively, how can I assess this? Is that actually true or is it not true? So we'll talk more about that later.
Yeah, and I loved your point on this slide of like it can happen to anybody. Tom Hanks, for example, that's a great way to put it. But also, just somebody starting out of college in their career, or even somebody that, it could be anybody. And it's not like something is wrong. It's just these feelings are common, and there's definitely ways to mitigate those and kind of cope with it and understand it more. And I love this topic and kind of what we're going over with it. So can you kind of talk to us about, again, some of the causes for imposter syndrome and kind of how that works?
Yeah, I mean, if we think of it as a personality style, and I think of it as kind of, what's my personality style? Am I someone who's typically, hard on myself and holds myself to high expectations? We look at what develops that, because that doesn't come from nowhere. Not everyone is doubtful of their own abilities. Some people arguably are not skeptical enough of their own abilities and think more of their abilities than is actually the case. We're talking about the opposite of that. Well, it shouldn't be a surprise that family upbringing could be a part of it. Did I have a family that set very high expectations for me? Was I expected to do well in school, do well in sports? If I did anything less than perfect, were my parents disappointed? That kind of thing. That over years and years, you start to internalize that. That starts to become part of who you are. And there's nothing inherently wrong with having some of that expectation, but sometimes it can go a little bit too far. Gender stereotypes can also play into this, the development of this. If it's, feeling like I have certain responsibilities as a man, or certain responsibilities as a woman in, that maybe it's traditional gender roles. How well I take care of the house, how well I provide for my family, whatever it happens to be. There is some suggestion that maybe it's more common in men or women, but really, as near as we can tell, it doesn't occur, more frequently in one gender than the other. Social anxiety can also play a part. We mentioned in the previous slide that this isn't just objective like work performance or professional performance. It also takes place in social situations. So do I feel like I am, I have a lot of anxiety around other people, and it feeds those self-doubts and that uncertainty. That can certainly be a part of it. And then, again, personality traits. Am I the type of person in psychology, kind of informally, we refer to people as, neurotic, which is kind of like, am I someone who is just kind of anxious and a little bit high strung and a little bit worried? Is that my personality style? And if it is, this is more likely to be the case versus if I'm kind of laid back and what happens, and if I do good, I do good, and if I don't, I don't. I'm not likely to experience that same sense of not being good enough or feeling like I'm fooling other people, because it doesn't matter so much to me.
We actually have a question that I think plays really well into this, especially kind of that last point. But they ask, is there a point when imposter syndrome can develop into something more pathological?
That's a good question. And it's not one that I have the answer to in the way the question is asked. I would say that a lot of what we attribute, what we've talked about here as being part of imposter syndrome, is also part of other things. So, a lot of what we talked about is also part of many anxiety conditions or depressive disorders. So it's probably fairly likely for people that are experiencing, this sense of imposter syndrome, but they're also dealing with other perhaps more clinical type of things as well, because nothing occurs in a vacuum. So yeah, that's a great question. And if you think about self-doubt, low self-esteem, being overly worried about how I fit into social situations or how well I'm doing my job, and those are also things that are quite descriptive of social anxiety conditions, generalized anxiety, major depression. So yeah, there is a fair amount of overlap between what we think of as of this, which is more of a mindset or personality style, and what we think of as more kind of diagnosable clinical conditions. Great question.
Excellent. And if you have more questions, feel free to toss them in. We've got about 15 minutes left, so we will have some time here for questions. We've already got a couple more in here, but if you have any more, feel free to enter those into the Q&A box. So going on, kind of, exactly what the slide says. What do you do if you are identifying with some of these traits?
Yeah. Well, first of all, realize that that's normal. Humans have this wonderful ability to kind of, we have frontal lobes and we can process things more intellectually and dig into things, but sometimes that can also have a downside, which is we overanalyze things. We worry too much about things. So if you're noticing these things in yourself, first of all, realize that it's normal. And it's not pathological. We aren't talking about pathology or you're not sick. This isn't an illness. It's just, your way of seeing yourself and seeing other people. So these are just some tips. They might work for you, they might not, but really just kind of think about these things as we talk about them. The first thing you can do is, show your feelings, be transparent. If I'm having doubt in myself, in what what I'm feeling or my role or whatever, the first thing I can do is just, talk to someone about that. Share, I'm feeling anxious, or I'm feeling like I'm not maybe really part of this group, or I'm not good enough. There's something wrong with that. And everyone has those thoughts, but some people are reluctant to share them. But sharing those feelings can go a long way towards undoing the what you might have built up in your mind about some of these things. The second thing is, assess your abilities. So with imposter syndrome, what we're talking about is I don't feel like I'm really good at doing what I'm doing. If the CEO, the CEO information that's out there is interesting, because you get these people that are heads of giant multi-billion-dollar corporations, and like, I'm not good enough to do this. Like, I'm not really that good. And like, well, you must be, because you got promoted to that level, and that doesn't happen by accident. But if we think of this as doubting our abilities, the second thing we can do is really assess our abilities. Okay, objectively, how did I do with that? Oh, actually, maybe I did pretty darn well with it. So maybe some of my doubt in my abilities is misplaced. Again, when it comes to confronting what we think of as faulty beliefs, or beliefs that maybe don't have a basis in fact, the way you do that is by assessing facts and then going, okay, here's what I believe, here's what I actually did, where do they match up and where don't they match up? The third point here is to start small, which is, don't try and do everything all at once. Start with one thing. If I'm, I have, let's say I get through this presentation and I'm like, oh, this presentation just didn't go well. I feel like I didn't know the topic, and I was kind of fooling everyone, and I didn't really say anything that was that intelligent. I could do a bunch of different things. I could go do a ton more research on the internet and compare it to the slides I have, and then talk to my boss and talk to this person, talk to that person. Or maybe I just call Shane and be like, hey, Shane, how did that go? Like, did it go okay? Did it seem, start small. You don't always need this big, giant reaffirmation, but just little affirmations, chip away at it over time. And that can sometimes help to get you out of that mindset. The fourth thing is question your thoughts. And, if you've ever been involved in therapy or mental health treatment of any kind, one of the things we often do is, when people have thoughts, and those thoughts may or may not be based in fact, but the first thing we do is, if someone says, I think that this person doesn't like me. Okay, well, look at that objectively, that thought, question it. Do I have any basis for that thought? What information confirms that thought? What information disconfirms that thought? But question it. A thought is not a fact. A thought is thought, right? So start questioning your thoughts, especially those thoughts that lead to self-doubt or negativity. Which, by the way, doesn't mean you're not going to do anything that's wrong or that things might not happen that are negative. Because you will, and they do. But one of the things we often do is, one negative thing can happen, 99 positive things can happen, and what we walk away with is the one negative thing. We don't walk away with all the other stuff that went really well. So questioning your thoughts is one way of balancing out your mindset when it comes to some of these things. Limiting social media is a big one, particularly when it comes to, I was going to say particularly when it comes to social, but I would say actually in relation to everything. I joke with my wife that, no one posts on social media, yep, I got drunk last night and my marriage is falling apart and I'm losing my house. No one posts the bad stuff on social media. What you see is, happy people and smiling people and people on vacation and people getting promotions and people doing this and people doing that. And there's nothing wrong with that. That's fine. But what that can lead to is when I look at my life, I'm not happy with a lot of things. And then I look externally at social media and everyone's happy about things. And then you start to feel like you're less than other people, or they have their stuff together and you don't. Well, that's not the case. It's just, again, people post happy things. They don't post negative things sometimes. But it leads to a comparison that's not an accurate comparison. If we did a true apples to apples comparison, we're probably all kind of in the same boat. We have some stuff that's good, we have some stuff that's bad, and most of the time we're somewhere in the middle. But consuming constant social media is one way to really get yourself mentally in the wrong headspace when it comes to these comparisons with others and comparing your own abilities. Don't let it stop you. This might seem kind of obvious, but Tom Hanks said every the first week of every movie he has doubts and he thinks he's going to get fired. He doesn't quit the movie in that first week, right? He keeps working. So as with most things in our lives that are negative or negative thoughts, pushing through, most of the time what we're going to find is that what we think doesn't come to fruition. And we only can figure that out if we keep pushing through. If we stop every time we hit a barrier, we're never going to move beyond that barrier. Most things we worry about never happen. Which, as a quick aside for any trivia buffs, Tom Petty said the best line he ever wrote in a song is most things I worry about never happen anyway. It's just we worry about things. That's what we do. Most of the time, those things never happen. So if we let it stop us, then we've created a problem for ourselves in our lives. If those CEOs and those sports stars and all those other people stopped in their tracks because they felt, I'm really a phony, I'm not going to make it, they wouldn't make it. So don't do that. And then I already talked in social media really about comparing yourselves to others, but there's really not much value in it. So try not to do that as well.
Yeah, those are some absolutely incredible points. And I feel like I related to some of those, especially looking on social media where, we had somebody else comment that every time they look on it, everybody's, happy-go-lucky, and you never know what's kind of going on behind it. And it's tough to not compare yourself to that. But you also got to remember there's other things going on too. So we've got about 6 minutes left. We have a few questions in here to ask, so that's great. If you have any others, feel free to enter them. Before we hop in, I just want to invite everybody to our next webinar on Tuesday, April 26th at 12 o'clock Central Time. This webinar is titled "The Good, the Bad, and the Cumulative. Is All Stress Equal?" and will feature R3 Continuum's Vice President of Crisis Response Clinical Services, Jeff Gorder. You can register today using the widgets and links on the screen, and more information on this webinar will be sent out soon. So getting started into the questions with our 5 minutes left here, I wanted to start out with this one that came in. It's a pretty broad question. I think it's kind of important, but how is imposter syndrome different from low self-esteem or low self-worth?
Great question. I would say low self-esteem and low self-worth are certainly a part of imposter syndrome, but how it's conceptualized here, it's much more than just that. It's a variety of factors that go beyond just low self-esteem or low self-confidence. But certainly low self-esteem and low self-confidence are a part of it. It's not in the same way that someone who maybe has chronic low self-esteem or low self-confidence, because again, oftentimes these are people at the top of their game, at the top of their ability. It's just the sense that maybe I've learned everything I can learn, and I'm just faking it through the rest of it. So low self-confidence isn't always going to be a part of it in a traditional way we might think of it, although it certainly plays a factor.
Excellent. Our next one here. Well, actually, before we go into the next one, I did get a question here. If this video or this webinar is being recorded, it is going to be recorded. You will be able to watch it on demand. That link should be sent to you a couple hours after this webinar concludes. So just keep an eye on your email. Otherwise, you can click the link in a few hours that you got here with, and it should pop up, and you should be able to watch that on demand as well. So our next question, how do you know when it's imposter syndrome or when you are actually an imposter?
I love this question. If you're asking the question, you're probably not an imposter. And I mean that sincerely. Like, if you have enough insight to ask the question, it's probably not the case. Because if you think about it, would a true imposter be able to do all of the things that you can do? Probably not, because again, this is someone that actually has the skills and the abilities, but they start doubting those skills or abilities versus, I don't know, what was the movie, Shane, a long time ago with Leonardo DiCaprio? Wasn't there a movie where he Catch Me If You Can was the movie. It's based on a real life person, but this guy just faked his way through a bunch of professions. It's kind of interesting. But if you're asking it's kind of like people go, how do I know if I'm a psychopath? If you're asking the question, you're not one, right? Because you just aren't. People that worry about it typically aren't. So great question. But if you're asking the question, you probably are not an actual imposter.
It was well worded. It was, I like that. The next question here with our about 2 minutes left, are there any assessment tools for imposter syndrome, whether it's clinician administered or even just self-assessments?
That's a great question that I don't have a clear answer to, because again, some of these traits that we talked about are certainly things that can be measured clinically. You could see this in many common self-administered or non-self-administered psychological tests. There are questions that get at self-esteem, self-worth, sense of own abilities, that kind of thing. But since it's not a clinical diagnosis per se, it's not like there's going to be a test or an assessment that I can ask. Although the first slide that we looked at if this was a diagnosis, I mean, those are really, for lack of a better term, the criterion, things that you could look for or ask about that might give you a sense of if someone is struggling with this or not. But good question.
All right. And our last one here, we've got just about a minute left. And I think this is a solid one to kind of go off with. Is imposter syndrome temporary or long-term?
That is a great question. My sense of it is it's not. You could feel it more temporarily. I could get a promotion and feel it more temporarily, or change in social status. If we think about it as, this is kind of part of who we are as people, how we think about things and how we think of ourselves. So it's not something that's going to be, it was there 6 months ago and now it's not there. It can show up. It might show up at different points in your life when there's a new challenge or new activity, whereas maybe you didn't before because you weren't pushing yourself or you weren't challenging yourself and you were in your comfort zone. So it's probably long-term, but there may be periods where these kind of thoughts, like, for Tom Hanks' example, the first phase of a movie is going to be that period where if he's going to have those doubts, maybe once he gets into the movie further, he starts not having those doubts. Or if I'm playing basketball, I doubt my own abilities, but once I get on the court and start scoring points, those feelings and those thoughts subside. So that's a great question.
Excellent. All right. Well, thank you, Dr. Arvig, for your expertise today. I know I really appreciate you being here, and I'm sure everybody else does as well. But it is about that time to wrap up. So thank you, everyone in the audience, for attending today. We know there was a few questions we couldn't get to, but if you have any other follow-up questions or feedback or comments for us, you can email us at webinar@r3c.com, and we can get back to you from there.